Hello, friends. Welcome to UK Dreamers. I'm Dr. Aman, and today we'll be talking about internal medicine training. Today, to join me is Dr. Saleha Azhar, who is one of the internal medical training candidates here in the UK. And today, she'll be talking all about IMT. How to get into IMT, what are the eligibility criteria, what are the group 1, group 2s for the further higher specialty trainings, her pearls of wisdom, and how do we proceed and get into internal medical training in the UK. So welcome, Dr. Saleha. Thank you so much for joining us.
Hi, Aman. Thank you. The pleasure is all mine.
Yeah, actually, big thanks for breaking up the jinx because you are the first female doctor actually having a talk. So thank you for accepting the challenge.
I hope I live up to the challenge.
Oh, thank you. You would. All right. So, Saleha, before we proceed, give a brief introduction about yourselves, who you are, where you hail from, what they do doing at presently, and so forth.
My name is Saleha. I am an internal medicine trainee, as Aman has said. I am from Kashmir. So I graduated from there. So I am an international medical graduate. However, I haven't worked there. So immediately after my graduation, I moved to the UK with my family, and I joined as a trainee in foundation training program through the UK FPO. Then I finished my training, and I just started immediately after my internal medicine training this year at New Cross Hospital. I'm a year one trainee working with Aman.
So congratulations, first of all, becoming a trainee in the UK. Okay.
Thank you.
So tell us a little more about what is internal medicine training. What is IMT?
So IMT is probably a new term, and a lot of people might have heard of CMT, which was core medical training. It's quite similar. It's the same pathway basically. So how the UK system works is you do your what we call an internship overseas. It's called foundation training here. It's for 2 years. So you complete your 2 years and then you apply for any specialty training, which could be surgical, medical, radiology, or whatever you want, psychiatry. We will talk about internal medicine here. So IMT is internal medicine training, which you apply if you're here during your foundation year 2, or if you're coming from any other part of the world, whenever you complete your internship, basically. So to get into specialties like cardiology, respiratory, dermatology, hematology, this is a training pathway. So it's basically a two-part pathway. The first will be your internal medicine training, which is either 2 years or 3 years, depending on which higher specialty you want to apply for, which we'll touch on later in the video. And then you apply again for higher specialty training. And by the end of that, the whole process is 7 years. By the end of those 7 years, you will be a consultant, hopefully. So internal medicine training, as I said, is either 2 or 3 years, depending on which specialty you apply for. They have grouped the specialties into group 1 and group 2. So group 1 specialties are more kind of acute specialties like cardiology, renal medicine, gastroenterology, respiratory medicine. So you have to do 3 years of internal medicine training, and you're in your year 3, you apply for those higher specialties. However, if you want to do something like dermatology, or if you want to do oncology, hematology, and some other specialties, you can apply in your year 2 of internal medicine training, and you can opt for those higher specialty training. Then obviously your higher specialty training will be 1 year extra. So you'll have 5 years of higher specialty training and 2 years of internal medicine specialty. That's how it works. So it's a very quick snapshot that I've given.
Yeah, so let's talk a little more about this. For instance, like someone has an interest in becoming a respiratory medicine specialist, for instance, and they get into the IMT training. So how does it work for them? As you said, respiratory medicine comes under the group 1 medical specialty, the acute medical specialty. So they have to complete all the 3 years of the IMT and then apply for a higher specialty, or do they finish 2 years and then they apply for the higher specialty?
Okay. So respiratory medicine is, as I said, acute specialty group 1. So for example, you wanted to do that. So you will apply for and again, we're talking about training pathways, not the non-training route. There is an alternative route. So purely training pathway, you will apply for IMT, you'll get your IMT, you'll do year 1 and year 2, where you will be working kind of as an SHO, that's a senior house officer. In your year 3, you will be working as a registrar. So it's a very good opportunity for you to just get accustomed to your role as a registrar when you will be applying for higher specialty and joining that. So year 3, you apply again. The applications are quite similar to IMT. You apply for higher specialty training in respiratory medicine. And you will go through how the application process is. You'll go through your portfolio. You will obviously make a portfolio that's well suited for that specialty, and you apply again for respiratory medicine. And then you will be working as a respiratory medicine registrar, where you will be doing general medicine as well. You will be doing some on-calls, and you will be dealing with all the general medical problems, as well as your focus will be your specialty, that is respiratory medicine. And you will do 4 years of respiratory medicine, and then you will have your CCT, that is Certificate of Completion of Training, and you'll qualify as a consultant. So all in all, 7 years, which will be divided as 3 plus 4.
Okay. That's 7 years of training, isn't it? Oh man.
It is, yes.
Okay.
If you go through it in one go, yes.
Oh yes. That's difficult to say as of now. Okay. So what about like the other group 2 specialties? For instance, take it like I've got a list in front of me, as you said, medical oncology, for instance. So as per my understanding, we finish 2 years of IMT, then you apply for the high specialty training, and the high specialty training would be of 5 years then. So still you complete 7 years in all total as a trainee.
That's absolutely correct. So you apply in your year 2, and obviously we will start next year. So another important thing of note here is the training in the UK starts in August. So it's every August that we start, and we apply in November. Most of the specialties applications start in November. So you apply, for example, next year, you apply this year, 2021 November, and then you will be starting next year, 2022 August. So you will apply during your internal medicine 2 year, but when you start, obviously you would have finished it by August.
Okay, so let's go into the very basic eligibility criteria for someone to be eligible to apply for internal medicine training in the UK.
All right. So it will depend on where you are coming from. The eligibility criteria is same, but what documents you would need would vary. The eligibility criteria is that you should have GMC registration. Then the other is, and that's full registration, not provisional registration. There are 2 types of registrations. You should have completed 24 months of practice, which, as I said earlier, is called foundation training here in the UK. Or some other countries have internships, some for 24 months, some for 12 months. If you have 12 months, then you will need some additional experience. And what you can get is a form called a CREST form, which is called the Alternative Competency Form, which is equivalent to your Foundation Year 2 competency form. Now, this CREST form could be you could get it signed by a consultant if you're working here in the NHS, or you can get it signed by a consultant in your home country, wherever it is. And make sure you use the latest CREST form. It varies every year, and the only valid one is the one that they issued that year. So make sure you use that version, and there is different criteria as to who can sign it. If you go to the website, IMT recruitment website, you can find all the details there. The third criteria is your English language proficiency, which you will be able to prove if you're working in the UK. That's an automatic kind of thing that you have been working, and you can get some feedback. Or sometimes they require a letter from a consultant as well. But if you have GMC registration, because they always ask for IELTS or OET, it's just self-explanatory that you are proficient in English language. So that's the main eligibility criteria for applications.
Okay. So one has a GMC and one has still not landed in the UK, but they can still apply for the IMT training that you're saying.
Yes, that's correct. So earlier on, if I talk about 2, 3 years ago, it was a bit different. There used to be, I think people are probably familiar with round one and round two. So round one was when the UK trainees would apply for the training, those who have the right to work in the UK. When the slots get filled, whatever was left was offered to the people from overseas. That was called round two, and then they would apply, they would get a visa, and they would get those slots that were available. That has changed now. Anyone from any part of the world can apply, irrespective of their right to work, and they will get a sponsorship. When they get the job, they'll get the visa, so that's not a problem. They're all on the same boat. And as I mentioned, the CREST form, you can get it signed from your consultant back home as well. So that's also not an issue anymore. So I think it's quite a good opportunity for international medical graduates to enter UK training system straight to the training rather than, if they want, not work as a non-trainee.
All right, that's actually great news for foreign graduates actually. Okay, so yes, now we've, for instance, like if it were me, so I've applied for the training, I got the CREST form, and now applied for the IMT training as the applications opened in the month of November for round one, as you said. So, okay, so then they process your application, find that you're eligible for the further like progression or not. They make you a short list. What I've heard is they offer you an interview, like invitation. And once you've had that interview invitation and you've booked the slot, then you go for an interview. Yeah. So can you give us a brief detail about this interview? One of my good colleagues has given me this book, basically. I've heard a lot about. I haven't opened it yet. Can you give us a brief overview about it?
Yeah, your colleague is actually really good. I think this interview book is very good, not only for IMT interviews, but also for higher specialty training interviews. So yes, as you said, when you apply, they filter the applications and they long list you based on the eligibility criteria, and then you'll get an email saying that you are eligible and you've been long listed. The next step is that they shortlist you for an invitation to the interview. Their aim is to interview as many people as they can. However, if there are a lot of people and they don't have enough slots for interview, they will shortlist you based on application scores, which we will talk about later. And that depends on your portfolio. And when you are submitting the application, you will given some evidence of those scores. So they will invite you for the interview. The final score will be some marks from your interview and some from your portfolio, the evidence that you've already provided. So let's talk about both. We'll start with the interview, as you asked about the interview first. It changes every year, so that's something that we should keep in mind. Their application, the application form itself changes, the application criteria changes, the scoring change, especially during COVID. Lots has changed since I think the COVID has started. So last year there were no interviews at all. There were plans of an interview, but there was a contingency plan, and they canceled the interviews. However, if you go through the interviews, it's usually 4 stations. So there will be 2 interviewers in each of the stations, and you'll have one clinical scenario where they'll give you the scenario. If somebody's familiar with PLAB, quite similar, OSCE kind of situation where they give you a scenario and ask you to take history exam and tell them the management plan. The second station would be your ethical scenario, where there's again a scenario, but it's not clinical, it's ethical based, to judge on your professionalism and how you are with your communication and your ethics. The third will be your commitment to your specialty, where the interviewer will ask you questions about why do you want to do internal medicine training, and maybe ask some questions to see how committed you are to the specialty. And the fourth will be your portfolio, which is the evidence that you have claimed marks for while you submitted the application. And then they will give you the marks accordingly. And then there is a certain weightage where they sum up all these marks and the portfolio scores they have. And then the total mark will be, I believe it's 80 this year that they will score you on. It's not a straightforward 80. There is a very complex kind of maths that's involved in that. And there is a weightage of different things. So that's how it is.
Okay, so means it's going to be challenging. If people are expecting it to be a piece of cake, it's not going to be a piece of cake.
No, it's not.
Okay, and okay, so this is the interview part, and you told a little about portfolio. So there are two confusing things here that I like to highlight. Portfolio, as in like your Royal College e-portfolio, or like the evidence that you've submitted for the interview per se.
That's a very good question. And when I was applying, I always had it in my mind that whatever portfolio, the Royal College portfolio I'm using, will be my scoring portfolio. And then turned out it's not. It's actually, if you go on the website as well, there is a list of evidence that they ask for, and then they score you based on that. So a portfolio, in simple words, I can say that it's a CV. So all your achievements, basically. And there are specific achievements that they are looking for. For example, any undergraduate degrees, if you've done any intercalated degrees, and they score you based on a criteria that there's a highest mark and there is a lowest mark. So it's not 0 or 1. If, for example, you have a degree with honors, you get 6 marks. If you have a degree without honors, you probably get 4 marks, and so on and so forth. So there is a whole scoring criteria in that. Then they are looking for any postgrad degrees, if you have any. Then they're looking for teaching, any evidence of teaching that you have delivered, or any evidence of any teaching courses or that you've done. Then there are publications, which could be a chapter in a book, or it could be a research paper, or any case reports, etc., whatever you've published. But again, you have to look at what they are looking for. So read the exact words. For example, with publications, they want it to be on PubMed. It can't be just any publication anywhere. There is certain criteria. So do have a look. Do give it a good read and understand what they're looking for. And all of these evidence, there are a few other things as well. So it changes again. It changes every year. So go through all of it before you apply, and make sure you have the right evidence. And when you're planning your application, you're working on the right things. For example, you're not working on a publication that they don't accept. And you spend your maybe months or years working on something and end up with no scores. So just go through everything. That's your portfolio. That's going to give you the mark.
Okay. So we've gone through the brief idea about the IMT per se. What are the subspecialty, higher specialty pathways? Keep in mind, guys, we have not discussed about how you directly get into ST3 or ST4. We'll be making next videos about them, like how to get the alternate competencies to get directly into ST3 or ST4, depending on the subspecialty that you're taking. Okay, Saleha, thank you for giving a brief, smooth overview of what's happening, basically what's IMT per se. So last but not the least, what are your take-home points for the people who are planning or who have already, awaiting their interview slots? How would you say, basically your pearls of wisdom, I would say?
My pearls of wisdom would be, I'll start from those who are planning to apply. I would highly personally advise to start working in the NHS to have a feel of what it is. Talk to the IMTs around you if you are interested in medicine. Maybe start a non-training job in medicine, because it could be a bit different from whatever you've been doing back home. So have a good feel of it and then decide. There is no rush. Once you land a job in the UK, even if it's a non-training job, you've got a job and you're getting the money. and then follow your heart and your passion. So do what you want to do. Prepare very well. Don't just apply, because you're ultimately applying to get the job. And I think it's very important to plan your application well. Keep an eye on the dates, because they would not allow you to request them or say anything if you've missed a deadline. So just keep a look on the website for that. Any changes in plan, especially during COVID. That book is very important that you just showed us all. I think use that book. I also read it for the interviews. However, I didn't get an interview because of COVID. So the criteria was a bit different, and I won't go through what it was. So prepare well, and your portfolio is very, very important. Make sure you're working in the right direction. So work hard, but I think work smart.
Okay, so have a look at the smart person who's giving you these tips. Okay.
Yeah.
Thank you so much, Saleha, for giving us a brief overview about what is IMT, how to proceed in the direction of IMT if one wishes to become a medical specialty doctor in the UK. And if you've got any further doubts, leave us in the comments below, or you can mail it us at the website showing in the background. And that's it from our end at the moment. Thank you so much, Dr. Saleha. Wishing you a very, very bright future in the world of medical specialties. And yes, I'll see you around.
Thank you so much. See you, Aman.
All right. Thank you so much. Take care. Subscribe to the channel, like to the videos. And if you've got any doubts, please comment in the section and we'll try to get back to you. Thank you so much. Bye.